I want to go across
Thank you
now.
so much, Rahul.
Live to New York. Joining us from there is Ian Lipkin. Ian Lipkin is one of the world's best-known virologists. He heads Columbia University's Center for Infectious Diseases and Immunity. He was the chief scientific consultant to the film Contagion. He, in fact, predicted that there'd be a pandemic of the nature that we're seeing with some variations, and that's exactly what we find ourselves still in the midst of. He's been a guest at the India Today Conclave, and we're very privileged to have him back. Professor Lipkin, thank you so much for your time, sir, and welcome back.
My pleasure.
I hope you've been well. I hope your loved ones have been well too.
Happy holidays.
Yes, it's not much of a holiday. That's a touchy topic. We're here working, having to cancel our holiday plans, but we'll leave that for another time. Tell me this, sir. In a worst case scenario basis, how bad is Omicron in your view? We saw Bill Gates tweet yesterday to say that Omicron will be the worst of the COVID pandemic, and after this things will get better. Implicit to his argument is the suggestion that Omicron will be worse than the Delta wave. Is that the way you're seeing this current variant as well?
I think we need to define worse. If we mean, is it more infectious? Yes. Does that mean that more people will become infected? Yes. Does it mean that if you're vaccinated, you can still become infected? Yes. Does that mean that this virus causes more severe disease in people who are partially immune or fully immune? No. So if you are not vaccinated, and if you've never seen the virus with a previous infection, then the chances are that if you become infected with Omicron, you're going to have severe disease, particularly if you fall into the categories that we've already known are associated with more disease. On the other hand, if you've been previously infected or you've been fully vaccinated, particularly you've been boosted with either the adenovirus vaccines, such as Covishield that's made in India, or you're receiving an RNA vaccine, the chances are that if you become infected, you're going to have milder disease. So Delta was different in that we saw severe disease and we saw a more contagious virus. This virus is more contagious, but may be less capable of causing severe disease.
If you can, we've read the scientific papers, but for everyone watching, if you can simplify as much as you can, how and why is Omicron different from Delta? If people have to take precautions, what should they be keeping in mind in terms of why and how Omicron is different from what we've seen so far?
So just starting with the virus itself, Omicron has mutations in a variety of regions within the genome, primarily in the portion of the virus that attaches to the outside of cells. Think of it like Velcro. It's got more teeth. It's able to attach more efficiently and then get into cells. It also has some substitutions in other portions of the genome that may make it more capable of reproducing itself in the nose and in the upper respiratory tract, as opposed to in the lungs. So this is a kind of a mixed blessing. It means that you're producing more of it. It's easier to generate the virus and to transmit the virus, but it also reduces the possibility that the virus is going to cause severe disease, particularly if you've had a previous exposure either to the vaccine or to the virus itself. Now, what does this mean in terms of protecting yourself? There are several aspects of this to consider. The first is that because there are going to be many people who are infected, but who are asymptomatic or have a sniffle, we have to be more judicious about gathering. We have to be careful about the types of masks we use. So any mask is better than no mask at all, but the masks that seal properly and prevent you from breathing around the sides are going to be more efficient. The best of them are the N95 masks or the KN95 masks. If you have access to those, use them. If you don't have access to those, then double up on masks so that you're clear that you're able to protect yourself because less gets in and less gets out. So that's one thing I think that is critical. The other thing is that large gatherings are very risky. So if you assume, for example, that 10% of the population, some large crowd, may be infected, the possibility that you're going to encounter somebody who is infected is much higher. Now, in this video that you're showing, some people aren't wearing masks at all. Oh, this is a problem. And we used to think that being outside was sufficient. I never really thought so, but there were people who did. But that's clearly not true if you've got a scrum of people who are all together exchanging air. That's the problem. So if you're not vaccinated, you must get vaccinated. If you've been boosted, great. If you're not boosted, get boosted. And during the interim, make certain that you mask and try to avoid large gatherings. That is all we can do. Now, you raise the question of, what I think of, Bill Gates' predictions. He's remarkably accurate. In the course of this pandemic, he's been very, very good. And even before, amongst all the various lay people I know, he has been interested in this and focused on this and has invested heavily in trying to reduce pandemic risk. That said, no one has a crystal ball. Now, my view of Omicron is that this virus is so well adapted to humans that virtually everybody in the world will be exposed at some point. It's just not going away. Now, does it look like seasonal flu? Not really, because as Professor Mukherjee said earlier, there's this other aspect to this infection that people don't much talk about. And that is what we call long COVID, or the post-acute syndrome associated with this infection, which can give you persistent headaches, muscle pains. It can interfere with your cognition. It can have an impact on your daily life in ways that other viruses typically don't. So even if you escape unscathed from major damage, you can still wind up with this post-COVID syndrome, which frankly can be very, very difficult. So people should take this very, very seriously. Now, the other point, which really is critical, is testing. Because so many people are asymptomatic or have mild disease, we need to be able to have tests that we can implement rapidly that allow us to reduce the risk if we're going to get together with people in close quarters. And I will say one of the remarkable things about biotechnology and pharma in India is because for years you have had people investing in this area. You have very good diagnostic companies. You have good sequencing companies. You have vaccine companies, the largest vaccine company in the world. So you really should be positioned, I think, with the appropriate investments to protect your people.
How long do you think Omicron will go on for, on the basis of all that you know so far? When do you see this nightmare end?
If you take a look at what happened in South Africa and what happened in the UK, what's happening in New York, this virus, unlike the previous ones, takes off like a rocket. It is rapidly replacing all of the other virus variants that we know of to date, with, such as Delta, for example. And it would not surprise me at all if this thing worked its way through the entire world by, the middle of next year. But again, that all depends on how people behave. So when you were asking Professor Mukherjee to model, there's so many unknowns in terms of the data inputs that it's difficult to predict. But we do know that this is the most infectious virus that we've had thus far, and that it could conceivably spread globally in a way that we've never seen before with any other viral infection.
Why?
So could we?
Why is this different from all the viruses you've studied, and this is what you do? Why is Omicron different from everything we've seen so far?
Because it is so infectious. That's the thing. I mean, what we try to do is understand how viruses spread. The viruses that are the most infectious are the ones that are spread by the respiratory tract: measles, smallpox, SARS-1, SARS-2, influenza. There's a wide range of them. When we compare the rate at which this virus grows, where it grows, its ability to spread, the amount that's contained in a sneeze or a cough, this is the most contagious virus that we've seen thus far. This is why it's spreading so rapidly. But it is in our power as humans to get this under control. But it requires that we think not only of ourselves, but of others as well. So you need to, even if you feel well, you need to test continuously. If you're infected, you need to isolate. If you can't isolate, then you need to wear masks. If there's a possibility for vaccination, you must take it, even if you think that this is something that you don't need. This requires that people care about one another. And it's a very different sort of a way of thinking about things, but we have to think of ourselves as a species that's at risk. And India leads the way in this philosophically, theologically. This should not be a difficult sale.
Do you have a sense of what the post-Omicron world could look like? I asked this to basically press you on whether there could be an other variant like Omicron. We saw Delta, there's Omicron, there could be some other character that emerges and then engulfs all of us. Or do you think that as far as this pandemic is concerned, after the third wave, we're unlikely to see another wave which surges in a crazy fashion and then spreads all through the world?
So the question is whether or not there's a possibility that there could be another virus that is even more contagious. I don't think that we're going to see a more contagious virus. What I am concerned about is virus that might evolve that would have other kinds of aspects to it that would make it more capable of causing serious disease. That hasn't happened yet, but if a virus, for example, developed in such a way that it could interfere with the ability to make an immune response, and there are viruses that have these immunosuppressive components, that would be a large problem. There could be viruses that would evolve that would have the ability to evade some of the drugs that are now coming online. That would be a huge problem. And this is why we need to continue to do surveillance to look for the potential emergence of these viruses. The other issue, of course, although I don't like to bring this up because it frightens people, is that this is not the last of emerging infectious diseases with which we have to be concerned. And there is a program that I've been promoting every time I go to India, starting with, work that I did in Goa and then in Mumbai and then Delhi and so on. We need a global immune system. We need better cooperation between ICMR and Pakistan and Indonesia and the US, Germany and Brazil, everywhere all over the world. Whenever a new infectious agent emerges, we need to be able to share the data. We need to be able to share the insights that are required to respond in an actionable way. And I make this plea every time I come on your broadcast. Please, if you want to work on this, if you want to join this global alliance, be in touch with me. I'm easy to find. We want to ensure that everybody everywhere has the toolkit necessary to identify infectious agents, bacteria, viruses, whatever, and respond to them rapidly and efficiently. We're all in this together. The other issue about vaccination, which I think is key, is that people tend to focus, particularly in the developed nations, right, on getting a third booster and a fourth booster and so forth. The fact of the matter is, until everyone is vaccinated, no one is safe. This variant, Omicron, probably arose in somebody who was persistently infected in an area where they did not have vaccines. And you see what it does. Anything, anywhere is rapidly everywhere.
From what you're saying, and if we have to look out for more infectious diseases in the future, and your predictions have been right in the past, are you suggesting that we may never go back to the world philosophically in the way that it was, that there would be a new world order where wearing masks, for example, is just standard operating procedure, and it could be several years before we go back to hugging, shaking people's hands, not having to worry about masks, being able to sit together. Is that essentially what you're saying, Professor? Professor Ian Lipkin?
There are certain times of the year when the risk is higher. I've been traveling, for example, for many years in Japan, where people wear masks during respiratory disease season. And they were doing this 20 years ago. They've done this since 1918, right, with the first flu pandemic that we were concerned with. So that is not something which I think, is a bad thing. I think the other thing is we do need to wash our hands more often. There are a whole series of things. We could talk for hours about what we need to do. But it's just like global warming. Are we going to go back to driving, polluting cars again? No, probably not. We have to think more cautiously about what we do worldwide. And everything you do impacts me and vice versa.
Last but not least, on the back of Omicron, how long do you see? Do you have any numbers for India? The wave in India, we're seeing in South Africa, it went up for 3 weeks and then came down, and that seems to be different from what happened during Delta. Do you have any particular numbers for India about when you see cases starting to surge in India, and by when do you see, in India particularly, the case count then once again coming under control?
So the issue is, when you try to make predictions about how things are going to spread, there are many social factors to consider as well. So if Prime Minister Modi decided to impose some sort of a shutdown, I'm not saying he should or shouldn't, that's above me. But if something like that were to occur, you would see a dramatic drop in cases. And it would be very rapid, it would be in a matter of days to weeks. If that doesn't happen, if the virus continues to spread rapidly throughout India, I would expect that just like in South Africa, that it would peak much more rapidly than did Delta. I mean, we're dealing with Delta months down the line. I don't think that's going to be the case with Omicron. I think it is going to spread much more rapidly because it can spread in people who've already been vaccinated. So this is, what is the peak going to be? I mean, it's conceivably possible that the majority of your population could be infected with Omicron. This is not out of the realm of possibility. Now, what would the impact of that be? That's sort of the most important thing. If people have previously seen this virus or a vaccine to it, majority of them will have mild disease. Nonetheless, there are people who've not seen the virus. They may have severe disease, and this can incapacitate your healthcare systems, overwhelm your hospitals, and then you have people who become ill and sometimes even, die as a consequence of not being able to get care for a difficult childbirth or a heart attack, whatever you care to consider. So these are very, very difficult problems logistically as well as scientifically.
Lastly, opinion in the government of India is divided over whether kids should be given vaccines and whether adults should be given a booster dose. They're thinking about it, they haven't taken a decision. On the basis of what you know, do you think that's a mistake? Do you think the government should post-haste, to the extent possible, start boosting people who've been vaccinated previously and ensuring they have some additional protection, some kind of bulletproof protection?
I think that if you have the doses of vaccine to do boosting, this is something that you should do. And with respect to children, for whatever we know to be safe in children, where you have smaller doses that are required, I would recommend that you do that as well. But it's very important to stay with the data that we understand and to be efficient in using those data to dictate your policy.
Professor Lipkin, you have a sense of clarity which is alarming at one level but eye-opening at another. I'm glad you accepted our invitation and made the effort of joining us on the news track. You've in fact, in the minutes that we've spoken, been able to give some very sharp insights about what's likely to happen and why. And I appreciate you taking out time. Thank you so much, sir, for joining us.
Well, I look forward to seeing you in New Delhi.
Will you fly, or would you just not fly at this moment? Would you be? Are you taking flights?
Well, I'm not going to swim.
No, for people who are traveling and wondering whether it's safe and worth taking the risk, what would Ian Lipkin suggest?
I think so. In my view, you can fly safely. You have to take the appropriate precautions. You need to make sure that the airline is considering the possibilities of airborne transmission with appropriate ventilation. You need to wear N95 masks. You don't relax your vigilance and start drinking alcohol and start hanging out in the aisles talking to people. But can you fly safely? I think everything is measured risk. But would I fly? Yes, I would. And I have to fly again. So, we have to learn to live with this new world.
For your clarity, for your thoughts, for your insights, and for your time, thank you very much.
My pleasure. Bye. Be safe.
And you too, please. I benefited immensely from this conversation about the last 45 odd minutes. I hope that it gave you insights to questions which have been in your mind, but you didn't really know what the right answer was. There is no right answer, but the three experts that we've heard from really carry the weight of medical evidence and data as they see it. And this is really as high quality possibly gets at this moment. So thank you for tuning in. I appreciate your time. And I look forward to seeing you at 8 p.m. tomorrow evening. Stay safe, stay well, mask up.